The coronavirus. What are state, local, and school officials saying about its impact? And how do we move forward? It's time to wake up.
We would like to welcome you to another episode of The Wake Up, the social distancing edition. As you can see, our format is a little different, as the coronavirus has made us do life a little differently now. Virtual happy hours are the new norm, but we are still committed to keeping you engaged and informed with what's happening in this political and economic world in Maryland, and most importantly, Prince George's County. I'm joined by my regular co-hosts, Jana Parker and Sherman Hardy.
Hey guys.
Hi.
Hey guys.
Hey everyone.
Today on the show, we have Maryland State Senator Melony Griffith, Edward Burrows, Vice Chair of the Prince George's County School Board, and Prince George's County Council Member for District 5, Jolene Ivey. Senator Griffith, thanks for joining us today.
Thank you so much for having me.
No problem, no problem. Senator Griffith, I know you represent the 25th District. Please tell us a little bit about your experience representing the 25th.
I am proud to represent the 25th Legislative District, which we affectionately call the 2-5, and happy to see two of my constituents on the call. There's still time for you to move if you'd like to join us in the 25th Legislative District, which is really central and southern Prince George's County.
This month, we had a historic end to the General Assembly due to COVID-19. I know there's a lot of talks about a special session this summer. How likely is that, and what can we look forward to for this special session?
No, you're absolutely right about the historic end. As you probably know, I served 16 years in the House of Delegates and now 2 in the Maryland Senate. And never in those 18 years have I seen a session that was only 9 weeks long. When we left Annapolis on March 19th, we really had conversations about returning for a special session. We thought sometime in May. If I were to venture a guess today, I would say the likelihood of that happening is not very likely. The members of the General Assembly have been working together with the administration through a newly formed legislative response COVID work group. And so those conversations are happening weekly, and at this time, no special session has been announced.
Okay. And that brings me into my next question. Please tell the residents who might not know about this legislative work group, this joint work group that you've been appointed to, like what you guys look to accomplish.
Well, thanks so much. At the towards the end of the legislative session, the presiding officers, which are President Bill Ferguson and Speaker Adrian Jones, jointly formed a work group made up of senior legislators from both chambers. So each chamber named 12 members that were made up of leaders that are committee chairs as well as other leaders. And it's a bipartisan work group. And this work group is sort of the liaison between the members of the General Assembly, our constituents, advocates, and the administration. And so we're meeting weekly, getting briefed by the governor and heads of departments or cabinet secretaries who are making us aware of the response that the state is taking to this unprecedented public health emergency. So in our early weeks, we heard from, as I mentioned, the governor, we heard from Secretary Bobby Neal of the Health Department, as well as the Deputy Secretary for Public Health, Fran Phillips. We've heard from Commerce Secretary, Labor Secretary. This week, we heard from the Attorney General dealing with some of the fraud and scam that's happening, not just in Maryland, but across the country. And so it's been both an information sharing from the cabinet and the state leaders, as well as an opportunity for those legislators who are appointed to the work group to ask questions that we fielded from some of our members and from members of our community.
Senator Griffin, thank you. Thank you so much for your service. We're running a little bit short on time, so we had just a few more questions for you. How can Prince Georgians directly or indirectly help the health effort more, other than most importantly staying at home?
Really good question. Thank you, Ms. Parker, for asking that. The first thing that I would say, you nailed it. I have to say it's social distancing, protecting ourselves and our neighbors when we leave the house for essential goods and services. Certainly using face covering. There's a lot of conversations. People don't have maybe access to masks, but I have lots of scarves. Folks are making masks out of t-shirts. That's first. Second is if you have resources and are able to give either financially or through some food donations, we encourage folks to do that. We're served by the Capital Area Food Bank. I know Mission of Love and some of our faith community are taking food donations. And the other thing that I would say is self-care, making sure that you're taking care of yourself so that you are healthy, mentally healthy and whole, whether it's doing something creative, drawing, writing, singing, dancing, whatever suits your fancy, just making sure that you stay mentally healthy and well during this crisis, because we're all going to have to work together for the next phase as we plan the recovery.
Absolutely, Senator. So, I actually just want to ask a question on a humanistic and a personal aspect, because I know, as you said before, you worked in the healthcare industry for a numerous amount of years. Can you give a face to what's going on in Prince George's County? Because we hear about what's going on in other states and we get the news highlights, but exactly what's going on in the hospital? What are some of the healthcare professionals, dealing with right now? And is there anything that we can do to help?
Thank you. Yeah, and that's a really great question. I have been talking to healthcare providers on a daily basis. And I want to extend a sincere thank you to all those that are leaving their homes and their places of safety to serve our community and our citizens every day. I want to caution us not to be too alarmed by the data that we see in terms of the positive test results, because basically we know the results are reported based on the communities and the individuals that are being tested. Right. And so we are seeing folks that are having some healthcare challenges. Folks are visiting health centers. We encourage folks whenever possible to use telemedicine. Remember, we're cautioning people not to go to the emergency room. Even if you have symptoms, call first. Obviously, if you have health symptoms that look like a heart attack or some other health emergency that would have you present to the emergency room, we absolutely want you to dial 911. But our healthcare workers are managing both the traditional primary and preventative health care and the response to the crisis. So the more we can do to use the phone, telemedicine, and those things will help.
Awesome. And, I also want to thank you for joining us today, Senator Griffith. One final question. In the light of COVID-19, do you foresee proposing any new legislation in the upcoming session that will help us mitigate or do something differently if this situation should ever arise again?
That's an excellent question. Before we adjourned, we really did pass some legislation to authorize the governor to utilize some of the funds that were in reserve in the state budget to respond to the immediacy of the crisis. But we're absolutely identifying as we go along any barriers that can be addressed through legislation. Right now, we're sort of building the bicycle while we ride it, but we're definitely tracking data. We're building metrics and making sure that we're keeping track of all of the things that arise so that we can prepare a very thoughtful and deliberate legislative response whenever we return to the Capitol.
We want to thank Senator Griffith for coming on today and sharing some valuable information on the General Assembly. Stay tuned. We'll be right back.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Welcome back to the Wake Up. Joining us now is Vice Chair of the Prince George's County School Board, Edward Burrows. Thank you for joining us, Edward. We would like to first extend our. Oh, yes, I apologize. We would like to first extend our condolences to all of the PGCPS family in relation to the loss of several PGCPS employees due to COVID-19. We are a family, and we are PGCPS proud. There have been several educators from PGCPS who have unfortunately lost their lives due to COVID-19. What is the school system's response to this in relation to providing support and grief counseling to the community?
Oh, it is a very unfortunate reoccurrence that we're seeing of our PGCPS family members who have contracted COVID-19, some of whom, as you mentioned, have passed away. Thankfully, so many are recovering. I know two in my district who are at a school in my district who have contracted COVID but are well on their way to recovery. And so we do have some of our PGCPS family members who are recovering, which is amazing. But as you mentioned, we have lost some, and that's something that we need to explore. What can we do to support our teachers and our students and school system employees during this time when we know that we're going to continue to see people pass away from it. So no, I think that's a fair question to raise that I think the board needs to explore. Not just with employees who pass away, but also in our county, we've seen an uptick in the amount of restraining orders and domestic violence issues that have occurred, and then our students are in those homes. And so I think it's
the trauma,
worthy. All of that. I think it's worthy for us to look at, what could we do to wrap our arms around our students during this time virtually.
These are unprecedented times. We know there has been a major shift in education and the way that it's being facilitated throughout the county, throughout the state. So how is the school system dealing with the ever-evolving COVID crisis in relation to educating our students?
Right. So that's another great question. So we've started distance learning, which took
and
a
you
lot
all were able to get computers out to everybody too, I believe.
Yes. So we were able to distribute Chromebooks and laptops to folks. But if you don't have internet, that becomes an issue. And so the school system is partnering with Internet Essentials through Comcast. So if anyone who's watching this does not have internet, we will make sure they get free internet. Anyone who is free and reduced meals, on housing assistance, SNAP, Medicaid, or any other sort of income indicator that might meet the standard, they could call 1-855-846-8376, and they'll have internet at least until the end of the school year, so that they can engage in the virtual learning.
And I'm pretty sure that probably, I'm sorry, I don't mean to cut you off, but it opens up for a lot more people because, as we were just talking with the councilwoman earlier, they've opened up SNAP benefits for the community in a more granular way than it was before, because we know a lot of people recently lost their jobs or, are furloughed. But I do want to ask, how are you guys coping with the board and being able to be transparent under the guidelines of the Open Meeting Act, since we're unable to physically meet?
Yeah, I mean, I don't like it at all. Not being able to meet in person is awkward,
Right.
Not having public comment. I mean,
Yeah.
Contact.
Makes all the difference.
Right.
When I tell you, well, of course, Shana Parker, who comes at every meeting, can tell you that public comment makes all the difference. I mean, our citizens' ability to hold us accountable around the decisions that we make makes all the difference when it comes to really important decisions, especially around budget time. We're entering into our budget time, and so we really need to figure out how to incorporate public comment. But there's really no substitute of being in the room. When you're in the room and with all of last year it was the mental health providers. Before that, it was reading recovery. Whether it's the teachers and support staff talking about pay equity, or in this latest case, We've had so many students come and testify for financial literacy. I think they made all the difference. So, I mean, it really is problematic.
What are the challenges and successes that our school system are facing in relation to the implementation of distance learning for the remainder of the school year?
Yeah,
and specifically, I know you're an advocate for the IEP. So if you could talk about the IEP portion, which is an individual education plan for children with learning disabilities, and 504, which is a learning plan for children with maybe behavioral issues. If you could just kind of talk about those things. Thank you.
No, for sure. I would say some of the challenges and successes, I would say the immediate challenge is just not being able to properly plan or not enough time to plan. I mean, it really caught us by surprise, this pandemic. And it's not like the school system got any advance notice when the governor was announcing that we would be shut down for the 2 weeks. I mean, we were in a meeting, myself, Dr. Thornton, Dr. Golson, and the TV was on, and we got it just like everyone else. So we immediately found out what we did. Literally. Well, yeah. I mean, it was now obviously, I think it's the elephant in the room. We're not going back. I can't imagine a scenario where we go back, but at the time we didn't know. And so just having to rapidly figure out how to, number one, feed all of these students. I mean, we have so many students who the only meal come from the school system. I mean, we have pockets of poverty and food insecurity in the county. And so that was priority number one. So then it was, okay, well, how can we continue instruction? And you mentioned a very compelling, very, very compelling thing, aspect, Jana, around students with IEPs and 504s. There's just no substitute for, I mean, we can try.
But Ed, I really want to ask you another question as well. And it's in along the same lines of where you're headed to. What are we going to do for the educators? Because as we know that the school year may not reopen. And if it does, it will be distance learning for quite a couple of semesters. So, and I've been speaking to some educators, and it's a burden to having to contact each and every child and, and try to get a hold of some of these people. What are we going to do to aid some of the educators in this, really new platform of what they have to accomplish?
I know we had several days of professional development for how to do distance learning with tutorials and the like. So I would say the educators, some of our educators might not have to have done all of this, or some of these things might not come so easy to them. And so I'm hopeful that those tutorials will be helpful. I do know one thing that we're doing to ease the burden is that for pre-K through 5th grade on our TV station, channels 96 for Comcast and 38, we have lessons streaming every day. So hopefully that will also help supplement or take the burden off. But at the end of the day, what we know, and I think what we've seen throughout this entire pandemic, is that educators are essential. I mean, and there's nothing that, we need them to do what they do best, and that's rise to the occasion and educate our students. And thankfully, everyone's still getting paid, and all of our teachers are still getting paid, our principals, assistant principals, central office staff. And so we just have to adapt and move forward.
And thank you very much, Edward, again, for joining us today. Stay tuned. We'll be right back.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Our final guest is District 5 County Council Member Jolene Ivey. She has many years of service to gorgeous Prince George's County. Thank you for coming on to the Wake Up. It is now Oh, I'm sorry. I apologize. Yes. Thank you for coming on. It is now a statewide mandate requiring masks be worn in establishments including food markets, grocery stores, and retail shops. How will compliance be achieved, and what are the steps residents can take to ensure that everyone is in compliance in a safe manner?
The important thing to know is that most people want to stay safe, right? There aren't a lot of people who are out there saying, you know what, I don't really believe that this is going on, and, you know, I'm not worried about it. I think most of us are. I started seeing people wearing masks before it was required. It just started being required. So, you know, I don't think that compliance is going to be a big issue. The way it works is the stores are expected to encourage compliance and educate people if they don't know. And, you know, you don't have to wear a mask per se. You can wear any kind of facial covering. You might have a t-shirt that you have to tie around your face. That's fine. The idea is to keep your own droplets in your own face and not share with others. So that is the reason for it, and it definitely helps keep people healthy.
And that is so true. And speaking on that, you know, topic as well, you know, I've had to go to a couple of stores in order to print stuff out for work. And, you know, they have signs everywhere that says if you don't have a mask, it's no entry. So, you know, stores are doing their part. Exactly. If you no mask, no buy, you know. But I do want to ask the status of the county acquiring the mask, and especially the N95s, which a lot of the healthcare professionals need, as well as a lot of the first responders. Where are we with that? Do we have enough now for them, or are we still working on that?
Just like the rest of the country, we do not have enough. And we're trying to figure out how to extend the usefulness of what we do have. So I know at Prince George's Hospital, I'm pretty familiar with what they're doing. The people who get N95 masks are pretty much also wearing a fabric mask over it. And those are being donated by people here in the community. I'm part of the group that's making them. And they put the cloth mask on top of the N95, which keeps it clean. And then they can cycle out that cloth mask all during the day. They can throw it into the wash and replace it with another one. So they're also getting some devices that can sanitize things, so that when you're done with your N95, you can put it in to be sanitized. And that's going to help us because we just don't have enough to do things.
And I do want to allow you to plug it really quick. You said that you're working with a group that's doing that. Can you give information to the public on how you can be reached, or that group can be reached, or what resources you all need?
Sure. I mean, if you email me, Jivey at that really long thing that the county emails are, co.pg.md.us. If you email me, I'd be happy to get you plugged in. Congressman, he'd certainly like that. Councilman Dernoga in Laurel has also been getting people to make masks, and they've been distributing them to people in that area. So it's definitely still needed. I had some communication with our fire department because it turns out they don't have enough hand sanitizer. And it's really hard to find, as you all know.
Yeah.
So I made it my business to start searching for hand sanitizer, and I found it, I am very proud to say, at a distillery in Frederick.
Woo, go ahead.
So I started by calling the distillery that's near me, Sangfroid. It's on Route 1 across from Franklin's, and they're pretty new and they're pretty small, and they are making hand sanitizer, but it's going to take them a while to get it going, and they're never going to have enough. Not enough for all our purposes. And they're making it a priority. Number one, the city of Hyattsville gets first dibs. And then after that, some other groups here in the county. But I've been helping the fire department. I found some, as I said, it is distillery in Frederick. And we're going through the process now of getting the payment done, and then someone from the fire department will physically pick it up, because we're getting it done in a big drum, which I cannot put in my car, just have a little VW, but they're going to go pick it up, and I'm really happy that that's something I'm able to help do.
Councilmember Ivey, thank you so much for that. We really appreciate your service, you hunting down these hand sanitizers, and we definitely appreciate just kind of everything that you've been doing in this time. We have to have wrap it up. We just wanted to give you 2 more questions. One question was, you know, what legislation is specifically coming out of the county council focused on the COVID response? And then just kind of, you know, we've gotten a lot of feedback from renters throughout the county, just, you know, with rent increases still happening, with letters coming from their management company saying, hey, once the if eviction freezes are over, if you're not up to date, we're kicking you out. So the next question is there any discussion about more protections for renters, maybe a moratorium on rent and rent increases?
Well, I don't think that we're going to say to anyone, you don't have to pay your rent, but we are saying that the landlords cannot put you out. And that's, I don't remember the date. I think it's through April right now.
Well, they moved it to June now. I believe another email just came out like June 4th or something like that, or?
Well, you know, we're going to keep extending it as long as it's necessary. Exactly. And what bothers me are the apartment buildings that aren't even sharing the information with their residents that they can't be evicted. A lot of them don't even know, because there are some low information people out there. You know, they're just trying to live their lives. They don't read the paper. They're not on social media. I don't know. I can't imagine, but they're not plugged in. Right. And so I was just having a conversation with one of the municipalities in my district where this is happening. And we're talking about making up some flyers with some basic information and just dropping them off at people's door. Like, you can't really door knock, but you can at least put flyers out for people so that they know that, and so that they know that they can apply for SNAP right now without having to worry about what their income level is. So SNAP is opened up, and that's really going to help people, and people just need to know that they need to apply.
Okay. Yes, we want to thank our wonderful guests for joining us to speak with the people of Prince George's on the social distancing edition of The Wake Up. Public service announcement to all Prince Georgians. Let's be safe, mindful, and thankful for all we do have during this uncertain time, because we will make it through together. Thanks for tuning in. See you guys.
Bye.
Thank you. Bye-bye.